Widzisz doktor Mazzę? Bo nie mogę znaleźć.
Hello.
Oh yeah, there she is. Okay. Hello.
Hello,
Good
how
evening.
are you?
I mean, good morning for you. Good evening for us.
Yes. Good morning, everybody, or good afternoon and evening to all of you.
Thank you for accepting our invitation.
Happy to be here.
Okay, Dr. Daniel Flynn has already told us about DBTA, and he did mention DBT STEPS as an early intervention and prevention program. And because we all believe that, especially now, this is what children and teenagers really, really need. So we are more than excited to hear more about it from you. And today with us is Dr. Liz Dexter Mazza, who is a certified DBT therapist, co-author of the DBT STEPS A, yes, DBT STEPS A, social program for middle and high school students. And she received her PhD from the School of Professional Psychology, if I remember correctly, in 2004. She completed also her postdoctoral under the direction of Dr. Marsha Linehan. So she's really the best specialist who can tell us today a little bit about DBT STEPS. So the floor is yours. Thank you for sharing this with us today.
Wonderful, thank you. Do you have my slides translated on your side?
If you can actually share the screen and show your slides, and there will be Polish translation going simultaneously.
Okay, great. Let me get that set then here.
Okay.
Oh, there we go. And then let me go here. Okay, can you all see my slides now?
Yes, it's perfect. Yep.
Okay, perfect, great. All right, well, thank you all for inviting me to be here with all of you. Let me just check, I'm not sure if you are looking at these slides now in presenter view or in which, oh, you are. Let me get you to
Yeah,
this.
I think it's okay.
Yeah, there we go. That's better. Is that better for all of you?
Yeah, it's perfect.
Okay. Fantastic. So I'm great. Oh, all right. There's chaos in my house as I do everything from home here. And there is a dog that is totally just taking down lights in here. So I'm happy to be here with all of you. Thank you so much for inviting me to be a part of this talk. What I want to talk about today is the DBT Skills in School curriculum, which is DBT STEPS A, which stands for DBT Skills Training for Emotional Problem Solving for Adolescents, and Upstream Approach to Mental Wellness. And I'm so glad that Daniel is on here, as we've done some great work with him. I'll talk a little bit about the results that he may have shared already from their preliminary study, and be happy to walk through all of this with you so you can have an idea of what is DBT STEPS A and how do we think about it as a real upstream approach to all that we are doing with our youth. And so, what I was thinking about when I was putting this all together is this idea of like, why DBT STEPS A in schools now? And we keep hearing, this phrase of now more than ever, we need an upstream approach to mental wellness in schools. And, the quote that I have on this slide here, although it is from the governor in my state of Washington State in the US, I think this is what could be said just about everywhere in the world right now that's really struggling with the impact of the COVID-19 global pandemic. So it says, whereas hospitals and health professionals who specialize in the treatment of children indicate that many of Washington's, and I would say all youth, are experiencing significant mental and behavioral health crisis as a result of this ongoing pandemic, which has been exacerbated by the continued isolation, difficulty engaging with virtual learning, lack of regular in-person interaction with educators, school personnel, mentors, peers, and so on. In February of this year, our governor declared a state of emergency in the state of Washington based on this behavioral health crisis and mandated that all schools by mid-April be back in person at least 40% time on some kind of hybrid schedule. Because where I live in the large metropolitan city of Seattle, Washington, our public schools were still 100% remote through April. And so we know that during this pandemic, right, that emergency room visits have increased, depression and anxiety, self-harm, suicide rates, social isolation, loneliness, substance use, all of these have increased for our youth. And they're getting ready now to start thinking about the ideas of going back to school. And I don't think we're prepared. Even in, you know, the information I was looking at for what's happening in Poland in a couple of the studies I looked at, you know, and we're thinking about what did student mental health look like pre-pandemic versus 2020. For youth ages 12 and up, we can see that almost half have felt worse or much worse in regards to their mental health in the year 2020. About a quarter are feeling the same, and just under 20% maybe felt a little bit better, with another 12% really unable to say any kind of report on how they're feeling. So that was just one study I looked at that's saying, you know, half of the youth in Poland are feeling worse than they did the year prior. When we looked at college students in Poland and kind of thinking again about their mental wellness, you know, 3/4 of college students reported increased psychological distress that required some kind of psychiatric or psychological attention, with their highest risk categories being females, first-year students making the transition into their post-secondary education, individuals who are already on medications, and an increased significant amount of stress due to online learning. Knowing that even in this post-pandemic time, as we start coming out of this, a lot of places will continue with either online learning or with online running of businesses, virtual meetings. There's likely to be a decrease in the number of people that return to in-person conducting of businesses after this, that we're going to continue to see big stressors. And I know this is, you all know about this, you're in the mental health field, you're experiencing this, and I'm kind of going through this because one of the things that I think is most important for us to think about and be aware of in the data is when we look at the past. And, you know, in this 2020 study, this group of researchers looked at recognizing that, you know, we know children and adolescents are going to have high rates of depression and anxiety. And what's even more important, I think, here is based on previous and historical data, looking at periods of forced isolation, that when individuals come out of forced isolation, that their mental health struggles continue to be present for up to 9 years. And why I think this is so key is because I know it's important, and I know so many people are working hard to get kids back into school, right? To get from remote learning back to in-person learning. And I personally worry that many places are trying to get kids back into school with the idea that being at an in-person school is the intervention to the student's mental health. And I want to make sure that we are aware that that's not the case. Getting kids back into school will help with their social emotional learning, with their mental health. It is not the independent intervention. What we need to do is to get them back into school, and then to start shifting some of our attention from a fully academic focus to a social emotional whole child approach focus as well. Because these problems aren't just going to go away, they're going to last for potentially up to 9 years. And we know that, like, we're just seeing more kids in the emergency departments, having more mental health related visits. And at least here in the States and in some other countries I know, we don't have the workforce ready to go to meet the mental health needs of many of our youth and our adults as well. We can't train people to be mental health professionals fast enough right now. So we really want to be thinking about how do we get these skills and strategies and supports available to students earlier as we go through, and getting it to kids that we might often miss. One of the things that we talk a lot about when we're training schools and working and consulting with schools is this idea that there's a dual factor model of mental health. And in this dual factor model, often when we look at kids in schools, we're wanting to know, like, on their symptoms of psychopathology, how many symptoms do they have? How do we see them? And in a dual factor model, we're saying we need to not just look at the students' symptoms of psychopathology, we also need to understand their subjective well-being. How do the students think they're doing themselves? And when we kind of look at both of these factors, we end up with 4 different quadrants of students that we want to pay attention to, right? A significant number, 57 to 62% will land in the quadrant of complete mental health, meaning that they report a low level of distress and they have high amounts of subjective well-being. Again, these numbers and this data, I want to say, is before the pandemic. I think these numbers are going to be a little bit slower coming out of the pandemic when we get back into school. But to just give you a picture here, right? So those are the kids that are doing well. The next group we have are the vulnerable kids, right? Those are the kids that report few symptoms, but they also have low subjective well-being. They don't feel great. They don't think they're doing great. They may be suffering in silence, and maybe not getting noticed by the school staff or educators or mental health staff because they're not showing many outward symptoms. And then on the other top corner, we have the kids who are symptomatic and content, right? Those are kids who have they're showing a lot of distress. They're showing multiple symptoms of psychopathology. However, they report that they're doing okay with it, that they can handle it. Their well-being is higher, right? And that those are both pretty comparable groups at 11 to 13%. And then the final group is the troubled group. These are the groups that we most often see when we think about our kids struggling with their mental health in schools. This is probably who we often see. Those are the kids who have multiple symptoms of psychopathology and they self-report on low subjective well-being and quality of life, right? And they're the ones that we give a lot of our attention to. Unfortunately, one of the things that happens is when we're focusing on the kids in the troubled group, the students that are in the vulnerable group and the symptomatic and content group often over time may move down into that troubled group because they're not being addressed. They're not receiving supports at the levels where they are. And by shifting our attention to providing more upstream mental wellness supports, we could potentially reverse the direction of that symptomatic and content group and that vulnerable group, right? Those are the 2 often overlooked groups. And by shifting the trajectory, instead of them moving down towards troubled, we can get them moving over towards complete mental health by helping them get the skills and strategies and mental wellness support earlier rather than later. And I think what that will also happen with is that we will start catching more of those kids we often miss, especially that vulnerable group. The vulnerable group, similar to that slide I showed earlier, often includes many of our females, many of our internalizers who are having more internal depression, anxiety, not engaging in outward problematic behaviors. So a lot of those kids that often get missed until they show up in the troubled group. So with this dual factor model, being able to assess your students, not only through universal screeners to see what types of symptoms they might be experiencing, but also on these measures of subjective well-being, that's going to be key to making sure we cover everybody. And so kind of really thinking about that, when we can have that model, it helps us to move into this idea of what is our proactive approach to mental wellness. How do we actually think about this? We really think about DBT STEPS A in schools as an upstream approach. In the States, we call that tier 1, or a universal targeted, a universal approach to building social emotional learning skills in all students, right? We're going to still help them before they start hitting the rapids when the waters aren't rocky yet, and giving them those skills earlier. And then at midstream, or tier 2, this is where we might be working with kids in smaller groups. We're going to address some of their risk and protective factors based on the school's priorities of what we know is going on with them. And then it's tier 3, downstream, is where we might start implementing more comprehensive crisis management and individual evidence-based programs within the school, right? I know many times when I'm working with schools, most of their work is happening downstream at tier 3, and we want to help them to move upstream over time. And one way that we do that is just to kind of put it down into a little bit more of a categorical picture for you, is through the students coming back to school in person in these next years, looking at what is their level of need and what is our approach. So if I start all the way over on the right, thinking about students' mental and behavioral issues on a universal level, we're going to focus on promotion. How do we promote social emotional learning, mental wellness, and resilience skills as a way of reestablishing or experiencing more school bonding with our students, helping them engage in school activities, move towards a more clear academic focus without all academic focus, and how do we build their peer relationships, and help them, especially the kids who are having this kind of what we call this mild collective traumatic response. Many people are all experiencing this, what we call the collective trauma of the forced isolation, of the impacts of the pandemic. And how do we bring these kids back together through promoting wellness and resilience in them? Because just the idea of coming back to school is transitional for kids. I know we've been consulting with and watching and working with lots of schools that even moving into school in person this year, many of our students are now experiencing what I'm calling a double transition. They've got like the transition that often happens at the early part of the school year, where they're coming back to school and kind of figuring out how to get set academically, while simultaneously here in the States, our kids are coming back to school, many of them, you know, late in the year. It's April, we finish in 5 weeks, and they're also now trying to reset their social footing. What does it mean to be in person with peers after a year and a half of being remote with them with little engagement? And by the way, there's only 4 weeks of school left, so I'm kind of done for the year as well, and trying to figure that out with them. So that's another struggle that many of our folks are dealing with as we kind of go through this. And so let's see. One of the other things that I think about for many of our people is just kind of this idea of when we move to this, when we move to this at-risk tier, right, these tier 2, these are kids who might be struggling a bit more. We know there's substance use, loneliness, bullying, antisocial behavior, and have this moderate collective response, trauma response. Right, and that's where we may move in on our prevention of, we see these kids are struggling some. How do we teach them DBT STEPS A, or social emotional learning, in small group formats, give them extra time for skills acquisition and coaching, versus our kids who need intervention are more high risk, more targeted. We know they're really struggling. There may be some life-threatening behaviors happening also. And how do we give them either DBT STEPS A with this what we call DBT informed counseling strategies, or even comprehensive school-based DBT in the school building? And those are the pieces that we want to kind of think about and go through with all of them as well. So let me just stop there for a brief moment and see if there are any questions from anybody as we kind of go through. Any questions? Nope, we're good. I'll keep going.
Yeah, I think everything is clear, so we can keep going.
Okay, fantastic. Okay. One of the things, I can't see any of the participants, so I just want to make sure I've got everybody on track with me. Yes, there is a question?
No, sorry. It's
Okay.
somebody's not muted.
Okay, gotcha. All right. So again, just like here's like from that earlier slide to now. From that earlier slide to now, I can go through and just say, like, we're looking here of what the proactive approach to mental wellness is. Again, at that upstream level is DBT STEPS A, our general education classes. How do we get social emotional learning to all students versus the smaller group format at tier 2, and then downstream where they may be that smaller group format and getting more DBT informed counseling support. Some schools can provide comprehensive school-based DBT or have their DBT clinicians being in the schools. And then in some schools where they can't, we try to help provide the school mental health staff with strategies from dialectical behavior therapy that they can use with the students in order to support and coach in the DBT STEPS A skills they get in their own classes. So just kind of wanted to give you that picture. The idea that I always think about for schools is that we often in schools, and my mental health staff in schools, are often the people who are like the 911 responders or the emergency responders within the school building. Every time there's a behavioral or emotional crisis for students, they're running to put it out. And by running to put it out all the time, they're not able to move upstream. And so I always think of the story or the phrase when we think about, we have to figure out how to stop pulling kids out of the river downstream every time they fall in. And instead, what if we move upstream and figure out why they keep falling in to begin with? How do we build a gate or a fence at the spot where they all keep falling in to keep them out and give them the support so that they don't have to keep getting drowning in the water? That's our goal. Move upstream to stop what we call the waiting to fail model. Because as you've heard probably from a lot of people here today, there's typically only really 2, maybe 3 ways that individuals tend to get access to or learn the skills from dialectical behavior therapy. First, there are the clients who are struggling with such extreme emotional distress, out of control, life-threatening behaviors that are in need of comprehensive dialectical behavior therapy in order to get that treatment, right? That's one group of people who tend to learn the skills from comprehensive DBT. The other group happen to be the mental health clinicians who decide they want to provide treatment or training in DBT, and then they go and get training so that as professionals, they can teach their clients how to use DBT. Or there's people who attend groups like the Family Connections program that Alan Frizzetti spoke about this morning, where they've got family members who are in DBT or struggling with behaviors, and so they want to go learn it to support them, right? We don't really have a method or a model before DBT STEPS A where anybody can learn these needed wellness skills, right? These are decision-making, coping, and emotion regulation skills that we all use. However, you have to be in one of these very specified groups in order to learn them, right? And so the fact that you've got Family Connections in Poland is great. So how do we get these skills to all the kids? We put them in their schools, in the places where they are located. And so, I'm not sure if Daniel showed this morning or not, but I'll just show you, some of the preliminary results from the work that Daniel did this morning. And in Ireland, where they talked about it, was, from putting DBT STEPS A in a school, and comparing it to their control group, we know that the kids who took DBT STEPS A versus didn't had a reduction in on their emotion symptom index of the BASC, and a reduction in their internalizing problems. Their reports of depression and anxiety were significant, right? So we're catching some of those kids in those vulnerable groups, especially because this study came out of with 72 female students. So often the students who get missed in getting their interventions in the school, that we can see that it is effective. At another unpublished study that we're working on here in the States, one of our middle schools that looked at 6th and 7th and 7th to 8th graders, this was 31 students, the same group of students. We looked at, from 6th grade to 7th grade, the number of behavioral referrals they had, where 30 students had more behavioral referrals and from 6th to 7th grade. And then in 7th to 8th grade, it was the first year they received the DBT STEPS A curriculum, and there were only 6 more referrals and 25 less, right? So there was a significant reduction in behavioral referrals from one year to the next for students receiving DBT STEPS A. And so that was really important also, that we see kids who are learning the skills are using them. So, this is just all part of my passion for why we need to get skills upstream to students earlier, right? And get them into the schools where, 1, we can make sure every kid learns them. 2, we have the ability and a larger workforce in order to teach these skills at a non-clinical level, right? The entire curriculum, when we talk about it, I'll tell you how when we wrote it and developed it, we developed it so that the individuals who teach it don't have to be mental health professionals, right? It was designed at a universal level for general education teachers. I have social studies, language arts, math teachers, science teachers, house parents in some of our boarding schools, all teaching the STEPS A curriculum, right? You don't need a mental health background because we're not teaching it as a clinical intervention. We're teaching it as a universal upstream. How do you use skills on the everyday basis when you're on, the sports field, if you're playing football, or even American football or European football, if you're playing tennis, or if you're in the theater on the drama stage or on the debate stage. How do you regulate your emotions effectively on the everyday basis? And so the curriculum is made up of manualized lessons that have scripts and exercises and examples. There's a student workbook that can be printed out for each student, so they have worksheets. Each lesson is designed for a 50-minute period. However, they are 30 standard lessons, but are also very flexible, right? They cover all 4 skills modules, and they're standardized, which is really important to us, that they're standardized with clinical DBT, with the Rathas-Miller DBT for adolescents and with Marshall Linehan's DBT curriculum. And so the reason why I think it's so important that they're standardized is because kids talk to kids. And we really want to work on destigmatizing that if kids are learning the DBT skills in outpatient DBT treatment or inpatient in the hospital, that they also know oh, and my friends are learning these skills in schools. So everybody starts having the experience that these aren't just skills for kids who are really struggling or have problems. These are skills that we all use. And we can start building that supportive skills-based language of support and coaching from peer to peer when we offer it in schools. And that's another thing that I think is really important. In regards to flexibility, we teach almost all of the skills from DBT, and they're numbered here on this slide of lessons. The first, orientation and dialectical thinking, are lessons 1 and 2. And then they go through lessons 3 through 29. Lesson 30 is a wrap up and a test for all the students. And one of the things when I say there's flexibility is that they don't have to go in this exact order. we have different schools that have moved the order around. And I think Daniel Flynn's group in Ireland was a great example of this, because when we designed the curriculum, we knew we wanted to teach dialectical thinking first, because I really always consider dialectical thinking as the foundation for having a growth mindset, the foundation for understanding other people as part of perspective taking, the foundation for building validation skills in relationships. And so we wanted that to be early. And then we taught the mindfulness skills, and we taught distress tolerance skills right after mindfulness as our first primary module, because they are the behavior regulation skills. And in some of the schools we were working with through development, they had kids who had a really hard time staying in class, who were engaging in problematic behaviors, that if we didn't teach them the behavior regulation skills early, they wouldn't be there to receive any of the other skills. However, in Daniel's studies and implementation, for some of their kids, they recognized that behaviors weren't a problem. Their kids were coming to school, staying in class, not being overly disruptive, that they didn't really need the behavior regulation or the distress tolerance skills right out the gate. So they moved the emotion regulation skills in first as the primary module, and taught emotion regulation, then distress tolerance, then interpersonal effectiveness skills. You will know your students, and you will know which order to put them in. We don't recommend you, like, say, do one mindfulness skill and then one distress tolerance and then one emotion reg and then another interpersonal effectiveness, and then just kind of go in random orders. We want you to stay in groups by module. However, the modules categorically you can move around to what best meets the needs of your students. And that, I think, is really important as well. So what I thought I would talk about now is to just kind of switch a little bit to some of the skills and why I think some of them can be so helpful, not only for our students, but also I think for our staff, for our adults in the building, right? The pandemic and didn't just impact the youth in our countries, it impacted everybody. And kind of going in and putting a focus on social emotional learning is also putting a focus on not just how we teach the skills to the kids, but how do we as adults learn skills and then model them to our students as something that we all use. One of the things that I do a whole lot of in my work in schools and then in my own house, because we have 3 kids who are 9, 13, and 14, so have all had their experiences during this pandemic.
Excuse me, some problem oh, sorry. We had some problem with interpretation, so please just wait a little bit. I will just turn on microphones of our translators. Yeah.
In the meantime, Liz, there was a question in chat. I don't know if you can see chat. There was a question about the minimal age of students that can.
Oh, great. I missed that one. I'm trying to pay attention to the chat and I did miss that one. So thanks for pointing it out.
Yeah, so
yeah, great question. Right now, the curriculum, the published curriculum of DBT STEPS A is designed for grades 6 and up in the States. So that's around age 12.
12.
Typically, so 12 and up. We're working on the elementary school adaptation right now. And so we do have some schools here that are teaching the skills at an elementary level. I know for several years we've worked with schools where they're still teaching these skills to kids. We're changing the examples. We're changing how we do it. Like I said, I have a 9-year-old who knows many of the skills, and she knows the skills because we've been actively using her and all of our kids as our practice ground for multiple years, right? So she has become an expert in what we call the dear man skills on how do you ask for things effectively from other people. And she does the D, the E, the A, and the R on a regular basis. So the skills can be taught to younger kids. Like I said, we're working on writing up that curriculum as we develop it and getting that published as well. But the straight manual that is there is currently designed for 12 and up.
Okay. Let me just check.
Okay, no problem.
Jak jest z tą? Jest, czy już nie ma? Czy jeszcze nie ma? Okay. Magda, ty mówisz do nas, bo jesteś zmutowana.
It is, please continue. Yeah, sorry.
Okay, you're ready to continue? Excellent. Okay. So one of the things what I wanted to talk about now is just like what are some of the skills? And I think many of you, as I've listened to some of the talks this morning, know about some DBT skills. And so what I always like to think about is how do we take these skills from a clinical side and move them into a universal setting, and how do we talk about them differently? And that was one of the things that as a psychologist took me a while to practice. How do we apply all of this to non-clinical situations with students, to not always talking about the kids who are struggling with anxiety and depression, to talk about the kids who are struggling with maybe some sadness or just desire to not engage or anxiety about taking a test on those levels of everyday instances and not at those extreme clinical levels. And so one of the ways I do that is first by when we're teaching mindfulness with students. I talk a lot with students and teachers about this idea that what we pay attention to is what we see more of, right? When we have to be mindfully intentional about what we're doing every day. And I think one of the things that happens is that as humans, we have a tendency to put our attention to things that are not going well, to the pain we experience. And the more we pay attention to problems, the more problems we might see, right? When we have the thoughts, everything's hard, I can't see this. You know, as parents, we do that often. As adults, when kids come into the class and they're making lots of noise, right, or talking or not paying attention, we're constantly telling them, pay attention, quiet down. You know, what are you doing over there? You're not doing what you're supposed to do, right? And we don't understand why when we only pay attention to all of that, that's all we notice. Whereas on the flip side, right, we don't typically pay as much attention to joy or other expected behaviors in students or in individuals. So we don't highlight as often as we likely should when somebody comes in and they're talking at a lower volume of voice, or they're sitting at their desk and they're paying attention, right? Or they're doing what you want them to do. And so helping them, students, to actively be mindful of ways in which they experience gratitude or joy every day is a part of increasing their mindful intention of what they pay attention to. So like an example I always talk about, and I have schools do this and I do this in my own house, is every night at the dinner table, everybody has to go around and highlight what are 2 things you are grateful for from this day. Where do you have gratitude on this? Where did you experience joy today? As a way, especially during this time of pandemic when everybody's been bored, they're stuck at home, they can't see their friends, they're sick of being on screens. What went well today? How do we bring more of that out and pay more attention to it? Another thing we do is with the skill, DBT skill of building mastery. How do you not only teach kids that they can do hard things, which is the skill of building mastery, right? To do something that's a little bit hard every day, but also actively and intentionally talking about that every day. So not only at my house do we go around and say every night, what are 2 things that you're grateful for today? We also do, what is one thing you built mastery in today? What is one thing that you didn't particularly enjoy and you got it done? Or one thing that was hard and you built some confidence or pride in getting that done, right? And those are often the expected behaviors, right? It's an expectation that we do the dishes, or that I make dinner for my family, or as a teacher, you know, I am checking in with kids or constantly working with them, or as a student that I sit in class and I don't talk, right? That's expected. However, for some kids, that's really, really hard. And when we can acknowledge and reinforce that behavior, we're teaching them that they can do hard things, right? That's another way that we kind of weave in this idea of building a growth mindset into our students. Another kind of skill that I think is really important that we teach our kids, right, on kind of this intentional piece, is helping them recognize when their emotions are running the show, right? And talking about that not in a bad way or a clinical way, but when are the times that your emotions are running the show, when you're in emotion mind, and how do we give our students the language to understand and communicate, like, I'm feeling so overwhelmed, I can't even think straight right now, right? I am so angry that I just want to blow up and I'm going to run out of the classroom. How could a teacher or another adult in the building have that common language? Says, does it feel like emotion mind is running the show right now? Right? We're giving a common language to students, and then we're going to give them these steps of, you know, how do you help yourself to pause? How do you practice noticing your urge to walk out of the classroom and not walk out of the classroom? Or if you're on the sports field in a basketball game or a football game, and there's a lot of pressure on you as the goalie, the keeper, right? And you just see the ball coming down towards you with all of the players, and you're really worried and thinking the whole time, what if I miss? What if they score? What if they score? My son's a goalie on our soccer team, the football team here, and there's a lot of pressure. There's a lot of anxiety that comes on. So how does he keep himself in wise mind versus emotional mind and panicking when he's working as a goalie, right? We help him to do one thing in the moment, to be non-judgmental, to validate that I can be anxious and I can still be an effective goalie or keeper, right? I don't have to get caught up in it, right? Asking ourselves, like, is this what I want now, or is this what I want most? This is one of my favorite sticky lines that I use with students around the skill, the mindfulness skill of being effective, right? Is this behavior in line with your long-term goals? Is this behavior that you're doing or this decision you're making, is it in line with what you want right now, kind of the short term, or is it in line with what you want most, your long-term goal? Or often I call it in schools, like, what's your big audacious goal? What's the big thing you're working towards that you want? And helping kids kind of really identify that can be helpful. Just kind of the next thing that we think about in schools is this idea of, how do I coach myself and or my students when we're struggling with painful emotions, right? What are some of the other skills that we teach them? First, on one side, we teach them when your emotion is a kind of a 65 or lower on the thermometer of 0 to 100, how do you use distraction effectively? What's an effective way to distract? How do you mindfully shift your attention away from your emotions and urges to act on them? And I see a question in the chat bar that I'll get to in just a second. Or, you know, equally important to distracting and shifting our attention effectively from our emotions, we also have to teach our students how to effectively sit with and experience their emotions like a wave, right? The thing we know about emotions, and that what people don't like about them, are the uncomfortable physical sensations that come along with them. When I feel anxiety, I feel it on my chest as a heavy weight. When I get anxious, I get a twisty knot and pain in my stomach. I don't like how those feel. They're uncomfortable. I want to push them away, which is where we end up in a lot of emotional avoidance. So we have to actively teach our kids, how do you experience or embrace discomfort and sit with those emotions and let them come in and go back out like a wave. And so these are some of the initial goals of the DBT STEPS A curriculum. Let me read the question in the chat here. Did you consider the children who tend to not under control side, but are more shy, quiet, and over controlled? Do they need some different skills that standard DBT can offer? Similar to RODBT. When we were developing the curriculum, RODBT was still in its early phases of development also. So our skills come mostly from standard DBT. I do think there's a lot of ways that we can help students to experience and understand, and in a way that with many of our kids, that we're not thinking about them on these clinical levels of over-controlled or under-controlled in their behaviors. What we're really teaching them about are how to identify and label emotions and how to experience them, how to make effective decisions through pros and cons and all of that. And so the way that it's covered on this general universal non-clinical level, I think they really do speak to the different types of problems that kids have. And then when we move into our more tier 2 or tier 3, where they're getting some more smaller groups or individual coaching, we can bring in some of the applications for those different pieces there as we go through. Let's see. Oh, and I see that Alicia also responded to that question. And then here's one more piece that I'll just talk about as the last skill that I can say is one place in which we have changed our lessons a little bit, in that there's a skill we call the please skill, which is really about how do you decrease your emotion vulnerability, your sensitivity to your emotions on any given day by taking care of your body. Right? How do you put the oxygen mask on yourself? By taking care of yourself so that you can help and support others as well. And historically in DBT, the PL in please has always stood for decreased physical illness, meaning taking care of yourself when you're sick. And when we shift this to talking about it on a universal level with kids in schools, we think about this idea with our please that the P stands for maintaining your physical health. When you're sick, take care of yourself. Stay home from school if you need to. Make sure you're seeing the doctor when you need to. But the biggest change we made is the L. The L no longer is part of physical health for us, but the L stands for limit screen time. We know that extended amounts of screen time, video gaming, YouTube, actually physically tires out our brain and makes us more emotionally vulnerable or reactive. So we work with students on how do you limit your screen time. And we talk about the different types of screen time, from academic screen time, virtual learning, or using your computer in class, to passive screen time like watching a TV show, versus mobile device screen time like watching YouTube videos and TikToks and social media, versus active video games, and how you might think about those in different categories of how you're using your screen time more effectively. Then we continue with the idea of like, how do you eat a balanced diet? We think with our students, how many of them don't eat breakfast early in the mornings, or don't eat other meals or just snack throughout the day. Instead of saying, with our younger kids, instead of saying avoid mood altering drugs, we talk about avoiding overindulgence. What are ways that some of our kids might overindulge? Oftentimes that's sugar and caffeine. How do they get balanced sleep, and how do we get them to move their bodies every day? Those are some of the pieces we work with them on at an earlier age, not just doing these things because they're good for you, but doing them because they decrease your vulnerability to your emotions. They decrease your emotion reactivity as we kind of go through. So that's kind of just like a few of the skills that we think about and how I shift them from this clinical approach to a universal approach and talking to all kids about them. Yes, I'm happy to share. I have an updated handout that we use in addition to just kind of like this poster here, thinking about. And I encourage classrooms to make posters like this, put them up. We're having posters made like this. People have them in their houses. This is one of the posters that a friend of mine made and put it in her house after we were teaching the please skills to parents through our live stream that we hosted throughout the entire pandemic on social media. It was called Parenting Through COVID-19 and Beyond, where we taught all the DBT skills to parents. We also taught them to kids, and by teaching them to our kids in our living room last year. We have a YouTube channel called DBT in Schools, and we decided early in the pandemic, since our kids were home, that we would teach the curriculum to them in our living room, and twice a week we taught our kids formally the DBT Steps A lessons and then live stream them out on YouTube and social media. So you can find some of these things there as well. But this was one of our adaptations. So let me finish with these last 3 slides I have of, you know, just kind of coming back to, if you're thinking about putting DBT Steps A in your schools or need to go and talk to people about why DBT Steps A in schools, these last 3 slides are just some of those talking points for you to think about. First, we put them in schools because it could be taught by general education staff as a universal curriculum, right? As part of the academic curriculum. And if not just thinking like, we really got to figure out, you know, what are all the academics the kids need in order to be smart enough, successful enough, but recognizing that as part of a universal curriculum, it's really important, right? That we educate the whole child, and it's a part of this upstream prevention approach, which decreases the potential need for one-to-one services downstream. I know as a clinical psychologist in my private practice, providing DBT to a lot of people over the last 20 years, there's still a finite number of people who can receive comprehensive DBT from just me, one clinician, right? And in the States here, at least, getting access to dialectical behavior therapy is very difficult because it's a very big comprehensive treatment, and it's very expensive, and it's time consuming and difficult to be implemented in community mental health. So at least in many of the areas I know, there's usually large wait lists for DBT, and it's very expensive. So most people either have to have insurance, which a lot of people have insurance. Most DBT clinicians don't take insurance, so people have to be able to pay out of pocket for it. So it makes it very expensive and very difficult to get. But again, I don't like having to wait till kids are struggling so much, thinking of killing themselves, hurting themselves, in extreme emotional pain, to learn skills that we could have taught them a lot earlier. It provides skill specificity and generalizability to schools, right? A teacher could be coaching in the classroom if somebody's struggling, I can't stand this math, I don't get it, I'm so frustrated, I just want to leave, right? The teacher, the math teacher in that moment could provide some coaching to the student and support, rather than saying, okay, maybe you should leave and go see the school counselor. And now the school counselor is back to putting out fire after fire and trying to get kids back to class. What if we can do more to support them in the classroom to keep them in there, right? And also, we're also now encouraging peer-to-peer support. Kids talk to kids before they talk to each other. And at least now, if we're giving them these strategies and skills, we know the support that they're giving has some meat to it, has some effect and positive outcomes to it, right? And we're also getting a common language for adults and kids to use, to be able to talk to a kid and say, like, do you think this is a motion mind or wise-minded decision, right? There's not a lot of judgment in that, and we can help support that with them. I also think just another piece is like this idea that, you know, we can have a universal curriculum that can also be adapted to needs of tier 2 and 3 students, kids who have a little bit more risk, a bit more struggle, by using what we also have is like, we have the full 30 lesson curriculum, but we also have developed some smaller adaptations of 8 to 10 lessons that we're working on collecting data on now for smaller groups, specifically like kids who are struggling with social anxiety in the school. What are 8 to 10 skills that we can teach them around managing their social anxiety? What are 8 to 10 skills that we can teach kids around that focus more on anger management in the school, or school refusal? We're helping with some of that. So we're taking from the universal, and now once everybody's received the skills, we're narrowing it down. It's like, okay, for this small group of kids, we are going to even dive deeper into this handful of skills for different topics. Many schools use other social emotional learning curriculums, especially in elementary schools. There's a lot more curriculums here in the States that schools use. and then they start to get fewer and fewer as we get into the secondary schools. However, DBT STEPS A can still be used in collaboration with other programs. It doesn't have to be one or the other. Positive behavior intervention supports, that's PBIS, and ruler are environmental social emotional interventions, right? And so we add in the skill specificity with DBT STEPS A, right? Once you've identified with ruler on the mood meter what emotion you're feeling, we can help them take what skill can you use to regulate or experience that emotion without making the situation worse. Second steps is another, and zones of regulation are two other social emotional learning curriculums that STEPS A works in collaboration with very nicely. And then the last things I'll talk about is that, like I said, why DBT STEPS A in schools is because it was developed from an evidence-based treatment for suicide and self-harming adolescents and adults, right? It is specific enough to address the emotional pain that's often linked to life-threatening behaviors in students, right? And we know that suicide rates continue to increase over time, and we have a youth suicide crisis in the world that we want to address. So we can give them skills that are specific enough and bring in individual supports as needed, while it's also the skills are general enough to help youth with everyday drama and emotional difficulties that they experience. And then finally, I'll say the last thing is that we know young adults and kids want these skills. I've been contacted so many times in this last year by high school students saying, what do I need to do to get my school to teach this? Or I want to start an after school program or a student youth club that's about DBT in schools. Can you help me on that? The kids are asking for it. For my husband, Jim, who's the co-developer of the curriculum with me, he developed at the University of Washington for their undergraduate students 2 undergraduate courses based off of the DBT STEPS A curriculum. The first one, which is a level 100 course, is called Wellness and Resilience for College and Beyond, right? And he teaches that course to over 1,200 freshman and sophomore undergraduate students per year. It fills up immediately when registration opens each quarter. Gets a wait list, and students, if they aren't able to take it in their first year, usually take it in their second year. Which to me, why that's so important, because that means that 17, 18, and 19-year-olds are coming to college and voluntarily choosing to pay for tuition dollars to take a class that's based on helping them be more successful in their life because they didn't learn these skills earlier. And what's even more exciting is many of those students went to Jim and advocated for a level 2 advanced class. They're saying these skills are great, we love them, we want more. So they had to add a level 200 class for students to take, and about 400 students follow up and take that class per year from the 1,200 that take the introductory course. And that class focuses on more DBT STEPS A skills and more positive psychology as well. So kids are asking for them, young adults are asking for them. So even more, we don't want them to have to pay for them or have to be at a university that happens to teach it. Let's move it upstream. Let's get them for all kids as we kind of move through this. I am so grateful for this opportunity to be able to speak with all of you and to kind of share with you the DBT STEPS A curriculum and how we can move it into schools. I am open for questions or comments. I'd be happy to talk more about it and stay on. So thank you for this opportunity to talk to you all. If anybody wants to follow up and reach out to me, if questions, you can always reach me at my email is right here on the screen at info@dbtinschools.com, or you can visit our website for more information at dbtinschools.com. We're also on social media, Twitter, Facebook, Instagram, DBT in Schools. Please feel free to reach out and connect with us or follow us on social media. We're always trying to put new information out. Thank you so much. And I will stop my share. So, see ya.
Yes, everybody says it's a very valuable program. We all want to implement it in Poland. I'm also in love with the idea of family dinners with gratitude and mastery. I'm stealing it from my family.
Excellent. Steal it. Do it. I tell people about it all the time. It's now just part of our everyday decision, like discussion around the table.
It's just great.
Right. It just, and I'll tell you, one of the reasons I do it is not because I want my kids to just be grateful every day. It is also the way that we're practicing mindfulness every day in their lives, because they know over time, oh, I have to talk about what brought me joy today, which means they're practicing paying attention in the moment to joy when it occurs in their day, or when they're doing hard things, to be able to talk about that and report on it every night. So thank you so much for this opportunity.
Thank you for sharing it with us. We are really all grateful to you.
You're very welcome.
Okay. Into chat. There's a lot of thank you for you, as you can see.
Thank you. You're all so kind. You know, maybe one of these days we will come to Poland and we'll bring DBT STEPS A to Poland. I know Anna wants to.
Yeah, I'm going to. Okay.
Myślę, że wiele osób w naszym stowarzyszeniu chce.
I think that a lot of people in our association would love to do it, but we also need to reach out to teachers, and I think that's also a challenge, because from what I can understand, this program is run by teachers. Do we have any teachers in the group today? And you can write in the chat if you're teachers, or if you know teachers, please let them know that the Polish DBT Association is preparing to run this program in Poland. Yes, I can see there are some teachers with us. Great.
Is it difficult to encourage teachers to do that?
Is it difficult to encourage teachers? Not, well, some. That's on one of those slides when I said, like, who's the ideal teacher? The ideal teacher is a motivated teacher, right? Teachers who actually believe in the need to teach social emotional learning. I have had schools who have mandated, in some schools where they say, every teacher is going to teach STEPS A, no matter what. And some do great, but when every once in a while you have some of those adults or teachers who say, this isn't interesting to me, or I don't want to do this, or I already talk about this stuff in my own way, I don't need to do a structured curriculum on it. Those are not the teachers that I would encourage you to have teach it, right? Because you want somebody who's motivated, has the buy-in, because we have to be extra bought in order for the kids to want to do it, right? Teenagers and young kids, like, if they don't have an engaged, interactive teacher, right, then they're bored. It's just like math. If your math teacher is really boring, you typically don't enjoy math. So you want somebody who's excited about the topic and motivated on it, and supported through their administration to put it in. And one of the reasons I think it's so important that we have our teachers teaching it over the school mental health staff is because our school mental health staff, which are often tasked with doing all the social emotional learning, they don't have a class. So they often, in the States here, they have to push in. Like, maybe every Monday they go into this class, but they only get to go in 5 times a year. Well, you can't teach a curriculum in just 5 meetings. Then you're just giving information. You're not teaching behaviors. And so when teachers have classes, we are more likely to put it in the academic calendar, the academic schedule, where the kids also see the importance of it. They can earn a grade on how to be a better them, be more effective for them, right? For kids who need to pull their grades up, that can be really helpful. It can be motivating. Yeah, Daniel says teachers can be motivated and school management also need to buy in. Teachers can get pulled from DBT STEPS A to teach core curriculum, right? And so part of it, it's like got to be that system on it. simultaneously, I'll say I have like in several schools this has happened where there's been like one teacher who decided like, I don't care if anybody else is teaching it or not, my kids are going to get it. I had one 6th grade social studies teacher who decided my kids are all over the place, I need to teach this to them. And so she built it into her social studies content and taught it in the first year. And it went so well that everybody's like, what happened to your class? Like they're so well behaved now. They listen, they're engaged. And she told them she did it, that within 2 years, it became a school-wide curriculum that all the kids got in 6th and 7th grade. So sometimes it just takes the excitement and one champion to show it's effective before it grows. So you can start both ways. And definitely commitment building, pre-treatment with school systems, absolutely. And that's what like I've had many times where administrators or schools have said, yes, we want this. Let's send our teacher, one teacher, or it's our school psychologist or school counselor to training. And then the counselors come to the training and they're like, this is great. This is what they sent me to do. However, I don't know when and where I'm going to teach it. I only get to do like a few small groups a year, or I only see kids individually. So then they go back to their schools and they say, great, but I need a class for this. And they say, we don't have a class. And so then the next time I do a training, then they'll send like their health teachers or their physical education teachers to the training, because that's where they figured out to put it in. So pre-commitment and pre-planning work is really important and helpful as well. So sometimes we'll meet with administrators before we even do any training for schools.
Okay, I think that's it.
Okay.
From the chat. We don't want to keep you long and longer. It's really.
Well, thank you. I appreciate you all very much. Thank you.
Thank you, Liz.
My bardzo dziękujemy.
Thank you very much for being with us. Yes, I think at the end you can